Ladies and gentlemen, my name is Didier Jourdan. I'm the chairholder of the UNESCO Chair and WHO Collaborating Center Global Health and Education. And it's a real honor for me to have the opportunity to share a few ideas with you about the way in which we can support schools to become foundations for healthy lives. Thanks for the invitation of Professor Marco Ackerman. When we talk about the promotion of health, we are talking about social change. Health promotion, as you know, is a set of coordinated and intersectoral actions that aims to orient and support social and environmental change in order to improve health for all and reduce health inequalities. And the different strategies of health promotion always relate to the three key domains that are the environment, the life ecosystem of the people, the capacity building in order to empower them, and the access to service. This vision, of course, applies to school health promotion. The idea is to influence the determinants of health, not only the determinants that are linked to the healthcare system, but all the determinants, social, cultural, environmental, behavioral, that are linked, closely linked to education. And everybody know that education and health are clearly intertwined. Education is, related to different kind of settings, not only schools. And that's why what's important is to harness the power of formal education, schools, primary, secondary, higher education, non-formal, this is popular education, association, sports clubs, and informal learning, families, and medias, community, social networks. But of course, within these different settings, schools has a very special place. School is a place like no others, just because simply 20% of the world's population is every single day in school. It's not only the students, it's also the professionals who are working in the schools. In fact, schools are vital social settings because they cater for this large proportion of the population and because, of course, they are places of learning where children and young people navigate their own development. Practices, research shows that to develop the capacity of schools to promote health, we need to have school policies, governance, partnership between school and community, school and parents, strategies linked to the school climate, the socio-emotional environment, to the physical environment of the schools, to the school curriculum, and to the school health services. But of course, knowing that is not enough because changing towards health and developing the capacities of schools to influence the determinants of health is extremely complicated due to the fact that the pressure on the schools and the school professional is extremely high. We probably need to think that we cannot lecture schools on what they should do from our point of view of health professionals. We cannot have this kind of moral positioning. What's critical is to support schools in their action on the determinants of children and young people health, and then to be able to show that a health promotion strategy is not another problem, but it should be a solution to existing educational challenges, of course, educational achievements, but also bullying, improvement of the school climate, improvement of the relationship between the school and the community. To do that, we need to work with the education professionals. And you know that for teachers, there's many priorities. And all teachers have first of all, to work on the languages in the different subjects. And the key question when we think about health promotion in school is to clearly show how health promotion could increase the coherence in all the different missions and activities of the teachers instead of adding another layer of complexity in their professional activity. And when it's about moving forward, we need to think through the lens of the capacity building of the school itself and then the school professionals. And our work shows that what is at the very beginning, this is the question of, the vision the professionals have of their mission in the field of health and the ethical limits. And working with them shows that we need to contribute to building a renewed professional identity for all the school professionals in the context of multiple crises. To talk more generally about what to do to promote health in schools, we clearly need to influence four key domains. One is the policies, and it's at the national level, it's at local level, but it's also about the mobilization of the civil society to help the population in general to understand how it is critical to mobilize the schools around health promotion. And again, you cannot create health without the people, and that's why civil society is always important. It's about structures and systems, school management. It's about human resources. It's about professional development. It's about support, and it's about practices, educational practices, and also the intervention practices of the community health actors. Clearly, we need to have this kind of integrated approach to move forward. But we cannot do that without the students themselves and without the healthcare professionals. I wish you a very good conference and thank you for listening to me.